Hello, and welcome to Module 1, where we will be discussing the fundamentals of informatics. The learner objectives for this module include discussing the development of health informatics as a discipline, a profession, and a specialty, to discuss the major theories and models underpinning informatics, to discuss evidence-based practice in informatics, and to investigate knowledge discovery, data mining, and practice-based evidence in health informatics. We'll also be discussing the defining of goals and processes in knowledge discovery and practice-based evidence. So there are 5 core competencies that should be achieved by all healthcare professionals. They include delivering patient-centered care, working as part of interdisciplinary teams, practicing evidence-based medicine or nursing, focusing on quality improvement, and using information technology. And informatics actually supports all of these core competencies in some way. So there are lots and lots of examples of how health informatics is being used and applied in healthcare settings. We have tele-ICUs or critical care settings where we can use telehealth applications for physicians to communicate with other members of the healthcare team, such as nurses, respiratory therapists. They can actually monitor their patients from afar. Robotics is another emerging technology that we're going to be seeing more of in the healthcare setting. Sensors are certainly more popular and more prevalent in healthcare areas and in home settings where we're able to monitor patients at a distance. Electronic medical records are another example, and many of you probably had experience with those. And then patient-generated data is another example. Certainly not a comprehensive list here, but examples of how informatics is being used with regard to patient care. So nursing informatics is really the convergence of different disciplines. For many years, we have described it as the convergence of information science, computer science, as well as nursing science. And you'll see more evidence of that as you complete your readings and the activities in this module. You'll also learn more about different theories that support nursing informatics and nursing informatics research. For example, systems theory, open system interacting with the environment theory, change in a system, chaos theory, complexity theory, information theory, general communication theory, and the data to wisdom continuum, which there's been a lot of discussion about in informatics. Recently in healthcare, we have put a lot of emphasis on making the best decisions for our patients and working with our patients to make the best decisions based on evidence. So decision making based on evidence means that the choices are based on the idea that research-based care improves outcomes. So turning to empirical evidence that supports why we are doing what we're doing for our patients. And then considering what intervention will most likely diminish the health problems that someone might experience. Another concept that you'll be talking about in this module or learning about will be the strength of evidence. And there are a lot of pyramids out there that exist. You may have seen this before, where we actually consider research and the content within publications, published research, published abstracts, papers, etc., where we consider the strength of that evidence. So was it written and reviewed by others? Was it an editorial? Was it an expert opinion? Was it a case report? Some other type of study or randomized control trial or systematic review? And the idea behind this pyramid is that the higher you go up, the stronger the evidence. So you will learn more about that again in your readings, and you'll actually have an assignment related to this idea. We'll also learn more about evidence-based practice frameworks. These actually provide a foundation upon which informatics solutions can be constructed to move evidence to practice. And there's been a lot of discussion about the length of time it actually takes evidence, research evidence, empirical evidence to make its way into practice. At one point, it was 17 years. I haven't seen a more, that was actually 1999 when that was written. I have not seen a more up-to-date statistic on that. And in fact, recently I was preparing something else and that statistic was still being used. So I don't know that it's been updated. We can certainly say that we are in a time when we have information coming at us from all kinds of different places, all kinds of different sources. And so we always have to consider where those sources are from. Are they authoritative? Are they relevant? Are they timely? There are a lot of questions we have to ask the evidence in and of itself before we begin to consider applying it. And then there are lots of pieces to the process that we must move through to actually begin to apply research. So there's a lot of moving parts in there. So there's a lot of reasons why it takes a bit of time to get evidence to practice. New solutions based on evidence, but we want to begin to think about how we can tighten that gap and get evidence and the use of that evidence in our current practice. So during this module and at any time during the course, obviously, please don't hesitate to reach out to your instructors should you have any questions about the content or the assignments.